Undertaken a very massive job in this country. We've been taking this massive job with the question about how we assure health care for all. I guess that's probably what it really does come down to, isn't it? And the challenge is one that we do that in a way which we have discovered over the years is really not so easy. One of doing it in a way that's going to assure good quality care and that it's affordable and that it's accessible. In 1993, we're doing this kind of questioning in a climate that's really very noisy. With the thundering herd at the White House working on health care reform, or whether it's here in the state of Vermont, maybe not a thundering herd, but something appropriate to a lovely environment. We're fully expecting that we're going to come up with some affordable, agreed-upon solutions. Agreed-upon solutions are going to be problematic. It's going to be difficult to get to where we want to be. A very key part of that, we think, is primary care. And primary care as a keystone to a solution, like anything else, means that primary care is probably misunderstood by a good number of people, depending on where you are as a consumer or as a payer or as an educator or as a hospital administrator. These are the questions that we are trying to pose this morning and for the duration of the symposium. And I'd rather use the word symposium. Conference somehow takes on the stance of we're talking to you. And this is designed to assure that there's lots of interaction between the people who are up here for the moment but are going to be back there shortly. As we tackle the problem of primary care and addressing a range of very difficult questions in the training area, in the service delivery area, and in the quality area, and in the cost area. A year ago when we had a conference on primary care, one of the successes was that we brought a lot of people together to talk about primary care from the standpoint of services and financing and services delivery and education. But there was a criticism that too often we were bringing people together who were already true believers in primary care, and that we needed to get out of the policy wonkville and down to some very practical, hands-on experience with folks who were perceived, at least, to better understand the problem and to try taking a problem in its most basic form. That is, to really get the rubber to hit the road. Some very practical, easy to understand problems that all of us, no matter where we hang our professional hats, can relate to. And that is the idea of this Socratic dialogue this morning, is to bring the conversations and the debate of policy options in primary care down to its very practical level. To help us with that process today is Charles Nesson, who is professor of law at Harvard Law School, where he has been a professor of law since 1966. And over that period of time, and perhaps before, I didn't check that far into his CV, he has authored a number of very influencing articles. As far as I know, they have not been on health care, and that's probably positive. Nationally recognized for his work examining complex constitutional issues, and has served, as many of you know, as moderator for a range of programs, some of which have been on public television. And his work as moderator for the media and society programs are particularly of note. The theater that we are creating for you this morning, and I like to think of it in some ways as real-life theater, is a theater that has a number of, I was going to say highly regarded, but I'm not going to be that presumptuous, but at least well-regarded professionals in a variety of areas. Linda Schofield, who is the Director of Medical Care Administration in Connecticut. Eleanor Amidon, who is a state representative from New Hampshire. Susan Sherry, Director of State Health Policy, Families USA Foundation. Judith Krause, who is Dean and Professor at the Yale University School of Nursing. Jerry Grossman, Chairman and CEO of the New England Medical Center. Nora Boyack, Executive Director of the Canopy Valley Regional Health, Rachel Block, the Executive Director of the Vermont Health Care Authority, Charles Baker, Secretary of the Massachusetts Health and Human Services Department, John Freumoyer, the Interim Dean, College of Medicine, University of Vermont, Mary Bidgood Wilson of the Tilton Family Health Center in New Hampshire, Bruce Bates, Associate Dean, College of Osteopathic Medicine, University of New England, Eileen Elias, the Commissioner of Massachusetts Department of Mental Health, John Tooker, Assistant Chief of Medicine at the Maine Medical Center, Jan Carney, Commissioner of Vermont Department of Health, Christopher Barberi, I hope I'm pronouncing your name correctly, President of Vermont Chamber of Commerce, and Barbara Seffett, the Associate Dean, Yale Law School. That's the cast, and I've just a note on videotaping. We're taking a film of today's program with the thought that we might get it down to an hour presentation for distribution to consumer organizations, professional associations, for general dissemination that we will have to decide depending on how well you and Mr. Nesson do this morning. And with that, let me introduce Mr. Charles Nesson.
Dr. Bates, you're in Appleville. Appleville is a beautiful rural Vermont community. And you're the doc. You're in your office. It's the biggest building in town. You've got a little part of it that you lease. You're in there late at night after you've let your people go home, filling out forms. They're in stacks on the desk. You're working on the pile they've rejected. You're trying to see if you just can't get them collected. And over there on the side, Mary Stark. She's a woman in her mid-30s, cleans the building. You see every once in a while as she goes through your office. You're working late tonight, Doc.
Seems that way.
What are you doing?
It's not unusual to be spending my time on the paperwork instead of the patient care issues.
Paperwork. I deal with a lot of paper, too. I've watched you, over the years. You do good work. I never go to a doc myself.
Well, I hope that's not because of any personal animosity.
No, I just have